PET scan, can you really pinpoint where the metastasis comes from in a person's body with PET scan?
Okay, so the PET scan that I showed you was just of the brain.
Of the brain. Okay.
And that's for that specific use of, you know, trying to tell the difference between progression versus pseudoprogression. In terms of looking at the entire body,
Okay.
yes, that's. We typically don't use. We do a regular CAT scan.
Okay.
To look for the primary site
Right.
of tumor. If we think that the brain mass is a metastasis. We typically, PET scans are used for staging or restaging, which means I have a primary tumor, where has it gone?
Exactly.
That's the main use. And I read a lot of PET scans of the body. I'm primarily a neuroradiologist, but I also read a lot of cancer radiology as well. And so we tell, for example, if a breast cancer has recurred or not. But again, that's not primarily for the brain, but it's for the rest of the body. Yes?
You said something before, just like glanced over.
Okay.
That radiation is not used for brain tumor patients.
It is used.
Oh, I thought you said it's not generally used.
Oh, it is generally,
Okay,
yes.
it is generally.
Yes.
Is it generally followed up with chemotherapy, or does that depend?
It depends on the type of tumor. I mean, if you take a lymphoma, for example, it's mostly treated just by chemotherapy itself. So it depends on what type of tumor it is. But like I said, most brain tumors, and again, I reiterate that most brain tumors are astrocytomas, primary brain tumors. They do get both chemotherapy and radiation. It's usually temozolomide. And recently the FDA in 2009 has approved called bevacizumab, which is Avastin, for use of recurrent GBM. Yes.
What would ischemic disease be?
Ischemic disease?
Ischemic?
Yeah, ischemic disease means a loss of blood, either temporarily or permanently, to a part of the brain. So the most common ischemic event is a stroke, all right, where you have a clot from somewhere, oftentimes the heart, sometimes the carotid arteries, breaks off and goes into the brain, and it stops oxygenated blood flow from going to that part of the brain. And that's ischemia. So ischemic disease just is the adjective to describe ischemia, which is the lack of blood flow.
So you wouldn't connect that with a metastasis, then? It would usually be indicative of a stroke?
Sometimes a pretty common complication from neurosurgery is to have ischemia around the margins of a resection cavity. So you go in and you take out the tumor. As you're retracting, you can slow down the blood flow to the point where there can be some ischemia along the margins. And we follow that. And that's a known entity. And that's something that tells me that something may not be real progression. That's actually came out recently in the literature. But I won't get into specifics about that. Ischemia, yes, typically has to do with a stroke. In fact, if you heard of TIAs before, it's a transient ischemic attack. Ischemia is the lack of blood flow. Very, very simply, ischemia, if I tied a rubber band around my finger, it would get ischemic. Anything that doesn't have oxygenated blood flow to it will get ischemic. After it gets ischemic, it can then become infarcted. And infarction is basically permanent ischemia. So a stroke can be temporary, that we call it TIA, or it can be permanent, at which point I would use the term infarct. So for example, one of the largest vessels to the brain is the MCA, the middle cerebral artery. I will say in my report, for example, this is an infarct of the right MCA territory. So that territory which was fed by the MCA is dead brain now. And that's what ischemia, ischemic brain, or infarcted brain really is. And somebody brought up encephalomalacia.
Yes, I did.
I use that term to describe infarcted brain. But it doesn't have to just apply to infarcted brain. It can also apply to old brain that had trauma to it or that had surgery to it. So encephalomalacia is a very general term.